Hello everyone, welcome back to my channel. Today we'll talk about the uses or the application of hydrogen peroxide in the field of dentistry. But before we continue, make sure to hit the subscribe button down below. Let's start now. Hydrogen peroxide, H2O2, it is safe to use in the field of dentistry. It has two uses. One of these is mainly used for whitening of the teeth, which is bleaching. We can see like in-office bleaching, and we have home bleaching. For home bleaching, we ask the patient to apply 1 to 2 times a week only. Overdose is not good because it can lead to hypersensitivity, so be careful. And the results are not permanent. Whereas in office bleaching, which is done by the dentist, the percentage that we will be using is 35 to 40% of hydrogen peroxide will be applied. The hydrogen peroxide works via the activation by light cure or chemical cure. The advantage of in-office bleaching is that the results will appear immediately, but it will disappear after 6 months, so it's not a permanent solution. So for both the home bleaching and in-office bleaching, the results are not permanent, and in both cases you will suffer from hypersensitivity. Here are the steps for in-office bleaching. Of course, number 1 is shade selection, to choose the most suitable color of the shade according to your teeth. And of course, we need to ask the patient, the most important, about his desire for the color that we chose. Step 2 is cleaning and polishing with the pumice to clean all the surfaces of the teeth before the application of hydrogen peroxide. Before the application of hydrogen peroxide, we need to dry the teeth completely. Why? Because the hydrogen peroxide is best absorbed when the teeth are completely dry. How you will dry it? We will see. By placing a gauze in the gum to prevent the saliva dilution. Because if the hydrogen peroxide contacted any saliva or any water, it will not be activated. So in order to be activated, the teeth should be completely dry before light curing it. Then after, we will apply our whitening agent, which is hydrogen peroxide. Of course, we'll apply it only on the frontal side of the teeth because its only purpose is aesthetic. We don't need aesthetic on the back side of the teeth, of course. Then after we are done, we need to rinse the patient's mouth to remove any residue of hydrogen peroxide because, of course, it is toxic and cannot be ingested. In order for the teeth to have a luster at the end or shining, we need to brush the teeth with a fluoride varnish in order as well to sustain the whiteness that the patient will have afterward. Very important, before we start any procedure, we need to warn the patient that he will have hypersensitivity in the beginning, in a couple of days, but after it will disappear. Another application of hydrogen peroxide, it can also be used to treat gingivitis and periodontitis cases. How? By inhibiting the bacterial growth that might lead to gum diseases. So if it prevented the bacterial growth, which means that it also can be used to prevent halitosis or bad breath. So here we need to ask the patient to bring a hydrogen peroxide solution, and we ask them to rinse for 30 seconds and apply it twice daily. Do not overdose because any overdose is not good for your health. So here, if the patient is suffering from gingivitis or periodontitis and he cannot go to the dentist to clean up his teeth, he can use for a short period of time the hydrogen peroxide solution until he's able to go back to a dentist to clean up his teeth. Thank you everyone for watching my video. Don't forget to like, comment and subscribe in my channel for support. Goodbye now.